ओंटारियो ਦੇ ਅੱਗੇ ਡਾਕਟਰ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਹੁਣ ਰੀਓਪਨਿੰਗ ਤੇ ਕੋਵਿਡ ਨਾਲ ਨਜਿੱਠਣ ਲਈ ਸੰਤੁਲਿਤ ਪਹੁੰਚ ਅਪਣਾਉਣ ਦਾ ਸਮਾਂ ਆ ਗਿਆ ਹੈ। ਡਾਕਟਰ ਕਿਰਨ ਮੂਰ ਨੇ ਵੀ ਕਿਹਾ ਕਿ ਸਾਨੂੰ ਇਸ ਵਾਇਰਸ ਨਾਲ ਰਹਿਣਾ ਸਿੱਖਣਾ ਹੋਵੇਗਾ। सोमवार तो लागू होने जा रहे नवे पब्लिक हैल्थ मापदंडों का ऐलान करते समय मूर ने भी कहा कि सानू यह समझना होगा कि असी ओमिक्रॉन वर्गे खतरे नू जड़ तो खत्म नहीं कर सकते। पिछले 2 सालों तो साडियां जिंदगियां डर के साए च निकल रही ने ते वायरस सानू नियंत्रित कर रहा है, इसलिए सानू अपनी सोच ही बदलनी होगी।
In this past week, our average percent positivity of tests is 18.41% compared to the previous week when it was 22%. Based on the current stabilization in Ontario's testing strategy, this is likely reflective of a real decline. Because of your extraordinary efforts to help blunt the transmission of Omicron and protect our health system capacity, we can gradually begin easing public health measures on Monday, January 31st, while still keeping up with the measures that are helping reduce transmission. This means that on Monday, we in Ontario will increase social gathering limits to 10 people indoors and 25 people outdoors, allow 50% capacity for most indoor public settings, such as restaurants, casinos, cinemas, with proof of vaccination, allow 50% capacity or 500 people, whichever is less, for spectator capacity in sporting events, concert venues, and theaters. And the 50% capacity will also include religious services, rites, or ceremonies. While this is positive news, we must remain vigilant in the face of this virus, and our continued reopening efforts must be implemented cautiously. This does not mean all hospitals will immediately resume the surgical and procedural activities permitted, and we are working with Ontario Health and the sector on this first step with additional details to be provided in the coming days. Once again, I want to thank Ontarians for the sacrifices you have made, not only in these past weeks, but over the last 2 years. January 25th marked the 2-year anniversary of the first case of COVID-19 identified in Ontario and in Canada. These last 24 months have been difficult and stressful for too many families, marked by tragedy and loss. All of this can take a toll on our mental health and well-being. And while Bell's Let's Talk Day may have been yesterday, let's keep the conversation going every day. Check in on your neighbors, your friends, and your family. And if you need help, do not hesitate to reach out and ask for it, whether it is for loved ones or from one of the many mental health resources in the province. Practicing self-care and staying connected has never been more important. Thank you. Merci. What we've learned through our Public Health Ontario partners who know of the incidence of Delta versus Omicron, they've told us that the vast majority of outbreaks in the community are absolutely Omicron, 99.9%. But in hospitals, given the severity associated with Delta, that their whole genome sequencing is telling us around 10% of admissions in the hospital are still relevant to Delta. And the whole genome sequencing data takes weeks to get back, so we'd have to correlate that with the death certificate to ascertain whether it was Delta and or Omicron. We absolutely agree that a significant proportion of the deaths in January would have been because death is a delayed signal from an outbreak, given that we've got access to healthcare and an ability to try to protect people through hospitalization and intensive care unit settings. In the first several weeks of January, we're confident that a significant proportion of them were from Delta, but now we need to tie them also with whole genome sequencing data.